Come in.
Hello, my name's Chris Edwards. I'm your nurse practitioner.
Hi, nice to meet
I'm
you.
going to wash my hands. Can you tell me what you're here for today?
I'm here for a well checkup.
Perfect, perfect. Well, one of the first things I need to do is I need to ask you a few questions. I need to check you. Tell me your name.
Emily Edwards,
Okay, and what's your date of birth?
3/1/1974.
Okay, and can you tell me where you are?
I'm at the health clinic.
Perfect. And then who's president?
Donald Trump.
Perfect, okay. Well, one of the very first things I have to do while we get started is I need to get your vital signs, okay?
Okay.
So I'll start with your temperature.
Okay.
Okay. And we'll do your
Okay.
Just rotate your arm out for me. Okay. This is going to get tight,
Okay.
and then I'll let all the pressure off. Okay. 117/78.
Okay.
Now, did they get your weight out front?
They did. They told me it was 120.
Okay. You'll stand up for me real quick. We're going to check your height.
Okay.
We'll try to get this down right below your heel.
Mm-hmm.
Five foot four, sound correct?
Yes.
Okay. Let's see, you said 120 and at 5'4", and 120 has you at a BMI of 21. 21 is fantastic.
Okay, great.
Okay. So we're going to check your vision, and I'm going to turn this from you from approximately 3 feet. So I ask you to close your left eye.
Okay.
Okay, now read the smallest line you can possibly see.
LTFPH.
Okay, perfect, and close your right eye.
LTFPH.
Perfect. Now, do you wear glasses?
I don't.
Okay, and if you did wear glasses, we'd want to check this with both your glasses on and your glasses off, okay?
Okay.
But with that, that's got you at a visual field of 20/20.
Okay,
Perfect.
great.
Okay. Now, as we get started, I'm going to check each of your cranial nerves, okay?
Okay.
All right, so the first cranial nerve we're going to check is cranial nerve number 1. This little tube's got a particular fruit flavor in it, so I'm going to
Okay.
ask you to smell it, and you let me know what fruit you think this is.
Okay. Cherry.
Perfect, okay. That is correct. Now, the next is cranial nerve number 2, and I'm going to be checking the fundus of your eye. So I'm
Okay.
going to ask you to just kind of look up here to the top of the ceiling right there.
Okay.
I'm going to get kind of close to you, and I'm going to shine a bright light in your eye, okay?
Yes.
Okay. Great. Okay. So now we're going to check your 6-point eye movement.
Okay.
Hold this little right here. And if you'll just stare at the tip of this pen, and move it outwards this way, and you just follow without moving your head.
Okay.
Perfect. Come close to you.
Okay.
That's fantastic. Great. That checks cranial nerve 3, 4, and 6. Now I'm going to have you to stare at this light right here, and we'll check the pupil response. Great. And that checks cranial nerve number 2 and 3.
Okay.
Okay, I'm going to ask you to, can you stick your tongue out for me? Okay, and move your tongue from your left to your right. Okay, perfect. That checks cranial nerve number 7.
Okay.
If you'll smile, or actually, excuse me, 12. If you'll smile for me, perfect. Kind of puff your Great. And raise your eyebrows. That's fantastic. That right there checks cranial nerve number 7.
Okay.
I want to look into your mouth. I want to look for your, then say ah. Great. I'm looking for your uvula to move. And that right there checks cranial nerve number 9 and number 10.
Okay.
Okay, I want to put my hand up here to you. I want to move against that, just that way, and push against me. Okay, and shrug your shoulders and downwards. That checks cranial nerve number 11. And cranial nerve number 8, I know is intact because you followed all of my commands that you're hearing.
Okay.
All right, so next we're going to actually start working from head to toe in the assessment, okay? So the first thing we do is we always inspect, just kind of looking at your shape of your head, looking at the folds in your face, looking for symmetry between your eyes, your nostrils, your chin, and the skin. I also want to look and feel through your head, making sure that there's no bumps, no lesions, no abrasions, no infestations, normal hair, no missing hair anywhere. That's perfect. So I'm going to look into your nose here with this. Just look upward into your nose. Perfect. Okay. Look in your ears.
Okay.
Great. Great. Okay, now let's see, let me get some gloves on. We'll look next into your mouth. Okay, let's say ah again. Perfect. Just looking at your throat, looking into your wet mucosa, looking at your teeth. No, a couple cavities on the top. Okay, look underneath your tongue. Perfect. Okay. And now I'm going to check your lymph nodes.
Okay.
Okay. First check the lymph nodes in front of your ears, preocular lymph nodes, and the pre-arc and the post-arc lymph nodes here. Feeling for your segmental lymph nodes, submandibular. Can you open your mouth and kind of close your jaws for me? Just feeling to make sure there's no crepitus or any popping there. Great. Just feeling down lymph nodes in your neck. Alright, and then the cervical lymph nodes, both upward, lower. Alright, now kind of shrug your shoulders. I'm going to feel the lymph nodes, clavicle. Nothing there. Okay.
Okay.
I'm going to listen to your carotids.
Okay.
So for this, I just need you to just take a deep breath and let it out, and just don't breathe for a second. Listening for any abnormal sounds, any bruise. And nothing there. Okay, good. Okay, so next I'm going to listen to your lungs.
Okay.
You can just breathe normally.
Okay.
if I can just get you to turn to your side here, we're going to list posteriorly. Perfect. Just going to untie your gown for a moment.
Okay.
While I'm doing this, I'm also going to just be checking your skin for any abnormal lesions, any places that, moles that look suspicious. Had any problems with anything that you've worried about?
I have not.
Okay. Just going to listen. Take normal breaths. Great. Tighten back up.
Okay.
Okay, spin back around.
Okay.
All right, now I'm going to listen to your heart sounds, okay?
Okay.
You just breathe normally for that as well. First is the aortic. Pulmonic. Tricuspid. Mitral. And the apical pulse. And from this pulse, we could also get a heart rate on you as well.
Okay.
I'm just going to first check your pulses bilaterally here, and then while I do this, we'll go ahead and get a heart rate. Perfect. Great. Why don't you check both sides?
Okay.
Okay. I'm going to check your strength. So I'm going to hold on to your hands. I want you to pull. I'm going to pull towards you and you pull. Okay, now push. Great. We'll check your reflexes there. So first off, just kind of bring your two fingers up for me so I can feel. Great. Okay. Just going to hit my hand here and you're going to do your perfect. Do the same thing. Just kind of move here. Great. Okay. All right. So now I could inspect your chest at this point, and if you were uncovered, I could, I again want to do the same as I did posteriorly. Anteriorly, I want to look for skin lesions, any kind of abnormalities on the skin, moles, any other skin areas that I could detect in that regards. Also, in part of the upper chest assessment is we could do a breast exam on you. If we were doing a breast exam, I'm going to need to check the lymph nodes underneath your arms, and I'm sorry about if you're ticklish. There's 3 areas to check. That is the deep, your mid-axilla, and then posteriorly in your subscapular, and then towards the front, in your subpectoral. Okay. And then also in part of checking that on that side is I would want to work my fingers through the tail of Spence and the breast tissue and begin to work myself from that area, moving forwards into the breast tissue, and then moving an up and down pattern on your breast, trying to feel any areas that I feel abnormal. Regardless of the size, I also want to check your nipple to see if there was any abnormal discharge, when likely squeeze, and then I would want to do that bilaterally. What I know part of that assessment is I would need to ask you to put your hands to your side, and then I would want to look for symmetry. I'd also want to look for any abnormal skin dimpling, have you to lean over, again looking for symmetry, and doing that, and then I want to put your hands up in the air, looking for, again, symmetry and any abnormal dimpling and anything in that regards. Okay, perfect. So let me get the bed. We'll go down to your abdomen.
Okay.
I've got to get this bed in the position that I can see here.
Mhm. Just lay down.
Yeah, that's
Okay.
fine. It'll take a second to get you in position here. Perfect. Okay, so I'm going to keep you covered, but I'm going to uncover your abdomen the best I can.
Okay.
Okay, and assessing skin. At this point, I also want to assess the shape of your abdomen, looking for symmetry, looking for the size to make note of that. One of the first things we want to do is we want to auscultate. So I want to listen to the 4 areas of your belly, just listening for any noises. Should hear quite a bit in each of the 4 quadrants. Okay, I'm also going to listen for your aorta. And the renal arteries. Okay, perfect. In some patients you can see the actual pulsation of the aorta, but in your case I don't see that, but it's normal to see that. The next I'm going to do is I'm going to percuss. You'll hear different sounds when percussing. Normally over the air pockets within your belly, you hear that nice tympanic
Mhm.
sound.
Yeah.
It sounds like a drum. But when listening to that and moving over solid organs, it changes to more of a dull sound.
Mhm.
Almost like hitting that phone right there. Same noise. And you can listen over the liver. Listen over
Mhm.
the splenic pancreas. Perfect. I'm going to feel your pulses here while we're here. Feel more pulses. Perfect. Now I'm going to do some palpation. I'll start lightly and just feel through the 4 quadrants of your belly, moving in upward and downward movement. Feeling for any nodules, any lumps. Asking if do you have any pain there?
I don't have any pain.
Then on the next time I'm going to get a little bit deeper.
Okay.
Okay. Perfect. Oh, sorry, ticklish. Cover you back up.
Okay.
Okay. I'll put you back flat, and you can just sit on the side of the bed again.
Okay.
And we'll move downwards. Now we're going to begin to look at your from your pelvis downwards. First, we'll just kind of take a look at your skin,
Okay.
looking for color, no lesions, no veins, issues in your skin there. You can just go ahead and make your thing. I'm going to check your, there you go. I'm going
Okay.
to check your reflexes. Perfect. Now let's
Mhm.
cross your legs over the other way. Great. Okay, good. Check your pulses.
Mhm.
Great. All right. Check your Babinski reflexes. Now this can be be pretty ticklish. It's gonna make your toes move up. Okay.
Yeah. Ooh,
Sorry about that.
that's okay.
Perfect. Now I've got you uncovered that way. I'm gonna actually take a moment and ask you about sensations. Okay.
Okay.
So I'm gonna just cotton. I'm just gonna ask you if you feel this in
Yes.
certain areas of your body. Tell me if you
Yes.
feel each place I touch.
Yes. 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 Yes.
Okay.
Yes.
All right. This is dull.
Okay.
This will be sharp. So I'm just going to kind of randomly touch areas on your body, and you let me
Okay.
know what you feel.
Dull.
Okay.
Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp.
Perfect. Okay. All right. Now, let's see. Let's test some leg strength here.
Okay.
So I'm going to first just lift your leg up, and I'm going to ask you to push. Okay. Now, pull. Okay. Same thing. Push and pull.
Okay.
Great. Now I'm going to put my hands right here. Push downwards and pull upwards. Great. Sounds good. Okay, I'm going to cover you back up there just a
Okay.
little bit. So next I'm going to, we're just going to come and watch your gait and watch how you stand, and then we will go from there. So if
Okay.
you'll just stand for me,
Okay.
okay, and just walk that way, and then turn around and walk this way. Okay, now stand. Now close your eyes. Stand. Okay, and you can open them back up. All right, so I'm going to stand here. I'm going to have my finger right here. I'm going to have you touch your nose and touch my finger. Touch your nose. Touch my finger. Now I'm going to move it. Touch your nose. Touch my finger. Touch your nose. Touch my finger. Touch your nose. Touch my finger. Now touch your nose. Now close your eyes. Touch my finger. Touch your nose. Touch my finger. Perfect. Okay. And if you'll turn around for me,
Mm-hmm.
look at your spine. Looking for the normal convex and concave, and looking for the spine to be midline. Yes, bend over and towards and touch your toes. Looking for the spine to be midline. Again, another opportunity to assess skin. Perfect. Okay, do you have any questions?
I don't.
Okay, well you can have a seat.
Okay.
If you don't have any questions, then that'll complete your assessment. Again, it's Joseph Edwards, Northern Kentucky University.
Thank you.